You know, when a stroke hits, it's sudden. And just like that, a clock starts ticking. In this explainer, we're going to break down exactly what's happening inside the brain during a stroke and why every single second is absolutely critical in this race against time.
Okay, let's start with a big number, a really big number, 150,000. That is how many people in the UK have a stroke every single year. It's a massive health issue for sure, but it's also one where acting fast can change literally everything.
You see, for the longest time, people kind of saw a stroke as this devastating event that you just couldn't do much about. But that idea is completely outdated now. Experts frame it as a brain attack, which puts it on the same level of urgency as a heart attack. This isn't something that just happens to you. It's a full-blown medical emergency that demands a massive, immediate response.
So what even is a stroke? Well, to really get why this is a race against the clock, we first have to understand what's actually going wrong inside the brain. And it turns out there are two main ways this can happen.
Get this, the huge majority of strokes, we're talking about 87%, are what's called ischemic. The other 13% are hemorrhagic. Now, both are super dangerous because they mess with the blood flow to the brain, but they're caused by two totally different, almost opposite problems. Okay, let's break this down with a really simple analogy. Think of your brain's blood supply like the plumbing in your house. An ischemic stroke is a blockage. A clot gets stuck in an artery, and just like a clogged pipe, it stops the flow. A hemorrhagic stroke, on the other hand, is a bleed. A blood vessel actually bursts, spilling blood into the brain tissue, just like a burst pipe. So you've got a blockage versus a bleed, two very different problems needing two very different solutions. Now, here's something that might surprise you. This whole life-saving journey, it doesn't start in the ambulance. It doesn't even start in the hospital. It starts with the very first person who sees something is wrong and makes that call. That's the moment the clock really starts ticking.
Which of course brings us to maybe the most important question in this whole explainer. How can you, a bystander, a family member, a friend, spot a stroke and get that life-saving response kicked into gear? Well, the answer is this incredibly simple but powerful tool called the FAST test. F is for face. Ask the person to smile. Is one side of their face drooping? A is for arms. Ask them to raise both arms up. Does one arm drift downwards? S is for speech. Have them repeat a simple phrase. Is their speech all slurred or strange? And then, the most important letter of all, T for time. If you see even one of these signs, it's time to call for help right away. Okay, so the call's been made, the ambulance arrives, and now the patient is in the hospital. The medical team springs into action. They're in a race now too, and their first big hurdle is getting the diagnosis right.
And before they can do anything else, there's one step that is absolutely non-negotiable: an immediate brain scan. And the goal isn't just to confirm, yep, it's a stroke, it's to figure out exactly which kind of stroke they're dealing with.
That scan is looking for the answer to one single, incredibly urgent question. Is there a bleed? Is this a burst pipe? Because the answer to that question is going to determine everything that happens next.
And right here, this is the critical fork in the road. If that scan shows no bleed, then you know it's a blockage, an ischemic stroke. The team gets the green light to use powerful treatments to destroy or pull out that clot. But if they see blood on that scan, giving a clot-busting drug would be a disaster. The entire plan has to shift to controlling that bleed and relieving the pressure building up inside the brain.
All right, since those ischemic strokes, the blockages, are by far the most common, let's dive into the amazing, time-sensitive treatments that have totally changed the game for those patients.
So the first weapon in the arsenal is often a treatment called thrombolysis. Basically, it's a super powerful clot-busting medication they give you through an IV. It goes to work circulating through your body, finding that blockage and just dissolving it, trying to get that vital blood flowing back to the brain.
But what about those really big, stubborn clots? Sometimes the medication just isn't enough, and that's where this incredible procedure comes in: mechanical thrombectomy. Doctors actually guide a tiny catheter all the way from an artery, usually in the leg, up into the brain, and they physically pull the clot out. It's like a plumber snaking a drain, but for your brain. It's just amazing stuff.
And this timeline, wow. This is where that phrase, time is brain, really hits home. For the clot-busting drugs, that window is tight, only about 4.5 hours from when the symptoms started. For clot retrieval, it's usually up to 6 hours.
Now, in some special cases, they can extend that window up to 24 hours, but the clock is always, always ticking. With every minute that passes, millions of brain cells are lost forever.
So once that initial high-stakes emergency phase is over and things have stabilized, the focus starts to shift. The immediate danger might have passed, but the journey to recovery and prevention, well, that's just getting started.
And it's so important to remember, the care doesn't stop. Not at all. It continues right away. As long as a bleed has been ruled out, patients will often get aspirins to help prevent any more clots from forming. And from there, the focus moves to a long-term strategy called secondary prevention, which is all about one thing: making sure another stroke never, ever happens.
And this prevention plan, it's the whole shebang. It usually starts with medications, things like antiplatelets to make your blood less sticky, statins for cholesterol, and meds to control blood pressure. But then comes the really crucial lifestyle stuff. Quitting smoking, eating better, getting more active. And all of it is backed up by regular checkups to make sure all those risk factors stay under control. So look, we've talked about some truly incredible medical advances here, right? Clot-busting drugs, these wild procedures to pull clots out of the brain, but the success of every single one of them depends on one thing that doctors just can't control. The single most powerful factor is time, and getting help fast begins with someone recognizing the signs and making that call. And that's the part you control.